Hi, this is Dr. Christopher Maloney, an naturopathic doctor. I'd like to tell you about an experience I had recently with alternative medicine to give you a sense of who I am and how I work. So I went in, and I have to be honest, there's this thing I have, it's called a phobia of needles. I have no problem needling you, I have no problem even if you need me to take off your toenails or doing minor surgery on you. It's when I get stabbed with needles, I have a very serious phobia, and actually it's not a conscious thing, it's called a vagovasal response where I simply start sweating profusely and may faint. So as a result, of course, it made sense to me to try acupuncture, where they stick lots and lots of needles in you. Maybe I thought this would be kind of a desensitization process for me. So I went into an acupuncturist, and I went in once, and it was okay. Well, okay being that I didn't faint. I wasn't very happy, but at the same time, it was okay. The second time I went in, unfortunately, I didn't realize that she was alone in the office and that there was no one else there. So I went in, I got 43 different needles put in me, all over my body. I'm in my shorts. And then she leaves the room, and I'm just lying there, and I'm, dealing with it. And then suddenly I have a dramatic urge to go urinate. And so I have 43 needles in me. I'm terrified of needles puncturing my flesh. It does give me a vagovasal response. I may faint at any point. I know this. And so I think to myself, I have to urinate. I think it's time for the session to be done. I'll get the needles out. So I call. I say, hey, hello. This goes on, I'll shorten it. It goes on for about 15 minutes because she's taken her dog for a walk and left me alone in the office. Now, I'm not going to name the person. She knows well who she is, and she's apologized for it. But the idea is that basically for the next 15 minutes, I'm calling, hola, hello, I have to go. I'm sitting there going, this has gotten to a point where now that you can't pee, you really have to pee, and I'm going to either go with these needles in me or go in the bed, and I can't handle going in the bed. So I get myself up with all my 43 needles sticking out of the front of me. I walk out the door, down the hall in my shorts, go into the bathroom, go to the bathroom. As I'm going to the bathroom, one of the needles stuck in my head goes into the bathroom, into the toilet. Yeah. And I'm looking down at that. See, I know that's a universal hazard, and I'm like, geez, do I go down and fish for that? I don't have needles in my hands, so I'm like, I'm not going to go fishing for that right now. I'll come back and get that later. But I turn around, and I go out the door, and she comes in the door right then with her dog, looking at me like, who are you? And I was like, well, I had to go. And she's like, Papa. I'm like, I'll be back on the table. So I get back on the table, and she comes in and takes the needles out. And the point is the way I dealt with it was I did everything I absolutely could to get help in that situation. And honestly, I went back and saw the practitioner again. Because you say, well, does that? I'm like, I gave her a second, third chance. And she did well the next time. She made darn sure she was in the office. But for the most part, what I do is I try to deal with things myself. And even in the worst circumstances, I want my patients to feel that I'm there for them, and that I understand, and that I get it when they don't like certain things. They don't like the ickiness of different herbs or some treatment. I do get it, and I've been there myself.